Latoya is the Director of Policy and Government Affairs at Doctor on Demand, which was founded to resolve the lack of access to affordable healthcare. Latoya will be presenting around overcoming isolation, anxiety, and emotional strain for caregivers and providing other related resources. So thank you so much, Latoya, and welcome.
Thanks, Lauren. I appreciate it. We can go on to the next slide. Thank you. And one more. Thanks. You know, the multidemics of COVID-19, violent trauma, dare I say even bigotry, and some of the healthcare resource and financial insecurity we've experienced over the past year has certainly left an indelible mark on all of us. I think that there's a collective feeling of exhaustion, anxiety, with just a sliver of cautious optimism. You know, with another wave of infection and hospital rates continuing to climb, and uncertainty over mask and vaccine adherence, you know, there's roughly 53 million family caregivers out there who are trying to cope with the social isolation, physical and behavioral health, and financial challenges that they encounter daily. We know that COVID has drastically impacted the demand for mental health support, and there is an increasing number of caregivers reportedly experiencing anxiety and burnout, especially over the past year. Behavioral health needs are skyrocketing as a result of the massive social, economic, and personal upheavals brought on by the COVID pandemic. But the good thing is that's come from all of this, if there is a silver lining, is the amount of data and research that we know now more about what is driving mental and behavioral health concerns. According to the Kaiser Family Foundation, nearly 4 in 10 adults are reporting symptoms of anxiety or depression during the pandemic, in contrast to only 1 in 10 from the previous year. Furthermore, 36% of adults are reporting difficulty sleeping, 32% are reporting poor appetite or overeating, and roughly 18% are reporting difficulty controlling their temper. 12% are reporting increased alcohol or substance use, and another 12% are reporting worsening chronic health conditions. The uncertainty of navigating this post-pandemic future certainly is taking a toll. Even more alarmingly, the number of people with unmet or untreated behavioral health needs is also increasing. Data from the CDC's Household Pulse Survey shows that between August of 2020 and February of this year, the percent of individuals with symptoms of anxiety and depression who had unmet mental health needs increased to roughly 24%. And an analysis by McKinsey also found total claims for behavioral health services a decrease by nearly 10% in 2020 compared to the previous year, despite the unprecedented number of Americans experiencing psychological stress and substance use issues. Next slide, please. You know, with the CDC's recommendation to use telehealth whenever possible, for Doctor on Demand, already having telehealth allowed us to quickly adapt to some of the access challenges that our patients and broader healthcare community were experiencing. You know, we are a telehealth practice and we provide 24/7 access to safe, quality, urgent care, primary care, and behavioral health services in all 50 states and DC through a suite of tools using video, voice, and secure messaging, which I'll get to in a few slides. We are the first nationwide virtual care practice to enroll and serve Medicare Part B beneficiaries. And we're also providing affordable visits to active and retired TRICARE beneficiaries and their families, as well as select Medicaid beneficiaries in key states. Because of this, we've been able to serve a vital public health role in mitigating the case of infectious disease spread, but also providing safe access to routine care for all who need it. Now, while we're all making sacrifices, we don't think that you have to make the sacrifices in accessing routine healthcare, including behavioral health. And that should include your choice of telehealth provider. So what are we hearing from our patients on their preferred healthcare experiences? And how is this impacting their experience with Doctor on Demand and also influencing their own satisfaction? Well, we're hearing from our patients that what they'd like is affordability and a healthcare experience that values their time. They'd also like to build better relationships, rapport, and trust with their healthcare provider. They also would like a healthcare provider that listens and provides guidance. They also would like a choice of the types of healthcare providers that they'd like to see, specifically those who are culturally concordant and also speak the same language as our patients. They'd also like some more services that are tailored and experience that really does meet their own needs. And of course, making sure that they can, when they are ready and when they would like, to be able to manage and coordinate their own care, but also the care of their loved ones. And finally, and most importantly, they want a healthcare experience that ensures privacy, security, and an intensive environment. And I'm happy to say that in working with our patients, whether they're caregivers or those for whom the caregivers are serving, we've been able to provide this optimal experience. Next slide, please. One of the things that we've been able to roll out over the past year to really help many of our caregivers and also patients who are receiving services through insurance is providing a slew of options and channels for our patients to receive behavioral health services. For us, coaching and therapy and psychiatry and working with our care team together provide what we consider to be a whole person-centered approach. For us, providing some level of coaching addresses what we consider life stressors and some other subclinical issues. And for us, therapy provides an evidence-based approach to addressing clinical, behavioral, and mental health issues. For psychiatry, that we feel like this provides more medication management for those who have clinical, behavioral health and mental health issues. And our care team provides a clinical care experience for many of our patients, really focusing on clinical, complex, and chronic disease. For us, all of these roles can refer within our behavioral health and clinical practices as necessary, but also to help ensure the right level of care is provided. Next slide, please. And now I'd like to walk you through a patient journey. This patient's name is Pat. Pat is 70 and on Medicare. She has a history of hypertension. She's retired, but also she is the primary family caregiver to her 77-year-old partner that has complex health conditions. Pat is right now working with her primary care provider and the care team under her care plan to really manage that hypertension. But Pat receives a referral because she's expressed some trouble getting her stress levels down. So the care manager suggests that Pat work with a mental health coach and notes this in her care plan. So Pat, in working with her mental health coach, is able to get access to that coach using our app and meets her coach, whose name is Ellen, and goes through a set of get to know you questions. Ellen acknowledges Pat's need to manage her stress and answers questions to assess her motivation for change. Both Pat and Ellen have a follow-up visit because Pat's issues weren't resolved in that first visit. And so there reviews an exercise journal and identifies some of the situations that are causing Pat the most stress. Pat feels the breathing techniques that Ellen suggested have been extremely helpful, and she's managing more physical activity as a result of this. Ellen even provides additional techniques virtually to Pat to manage some of these specific situations. They go on to create a care plan for Pat, and her coach, whose name is Ellen, recommends tracking some of these situations that Pat may feel are more overwhelming for her and noting when they're happening so they can keep track of it. Again, her coach, Ellen, gives her some breathing techniques and some exercises and recommends setting aside roughly 10 minutes twice a day for some brief exercise. She also, her coach also refers her to a company fitness app to use, in addition to using the coaching component on the app from Doctor on Demand. The coach provides her with notes for her to follow up, and they continue their relationship. So this is a useful tool for Pat, in which Pat was able, in working with not just her virtual primary care provider and virtual care team, but Pat was also able to use these virtual tools to access the coach and to remotely have conversations with those coaches to manage her stress levels, but also managing the more physical side of her healthcare, which was the hypertension too, which is extremely important. Next slide, please. I'm happy to just kind of share, just wrapping up a little bit here, that as we've walked through Pat's journey and we've walked through some of the reasons why so many of us are experiencing concerns over stress and depression, anxiety, and even social isolation, that with many of the tools that are available today, it's really important to keep in mind some of the qualities of having a good therapeutic relationship with your healthcare provider. One of the things that Doctor on Demand is providing to many of our members, and again, available to anyone who'd like to access it, is really that provider member or provider patient relationship, really reinforcing qualities like mutual trust and respect and caring, general agreement on the goals set forth, not just by your behavioral health provider or coach, but also mutual agreement from the patient and member as well. Shared decision making, the freedom to share any negative emotional responses, but then also the ability to correct any problems or difficulties that may arise in the relationship. What's really convenient about accessing our behavioral health providers is that all of this can be done at your whim when you'd like it, because they are available 24/7. So whether or not caregivers or those that they are caring for would like to see someone using the video or see a healthcare professional using our coaching capabilities, which you see a little screenshot of using text-based, they really are available to you using your iPad, your smartphone, or using your computer, and available to you at any time you'd like to use it. So I would just like to bring up, and I know that it's going to be in some of the resources slides a little later on, but there is a risk for many of these services who are presently available to Medicare recipients today. There's a risk that they may not be available to you come January. There was a policy that was implemented in December of last year that would require any Medicare recipient who would love to receive these services remotely, require that they see a provider in person before they can get access to some of these remote or telemental health services. And I'd encourage all of you to reach out to your lawmakers and tell them to remove that arbitrary barrier that is the in-person visit, and really allow you to get access to the entitled behavioral health services that are covered by Medicare today. So with that, I'd love to wrap up and pass it along to the next speaker, or open it up for any questions.
Thank you so much, Latoya, and thank you for sharing. I know it looked like in the chat, a lot of folks were excited about having this sort of model of relationship-centric model of support with a provider available all the time. So I wanted to just bring up some of the questions that had come up in the chat. So one person asked if Doctor on Demand is available in all 50 states.
We are. Not only are we available in all 50 states and the District of Columbia, which is where I live, we are available 24/7 and 365. I'd also just like to highlight just our ability to kind of reinforce that relationship-centric support, that if there is a provider that you've seen or communicated with that you like, and you'd like to continue that relationship with them, you can certainly do that and have follow-up relationships with that same provider, and instead of choosing a different provider every time.
Great. So it sounds like there's an option for just accessing care generally, and then for really kind of the same relationship someone might have in office with a primary care provider, that they don't have to look up your chart so much, they might know you already. Another question we had is, how does one start their care plan with Doctor on Demand? And I think you answered this, but put it up again. Are Medicare beneficiaries eligible?
They are eligible because of many of the policy flexibilities that were instituted last year. For the first time, we were able to open our virtual doors to Medicare Part B beneficiaries. As I've mentioned, we really appreciate the opportunity to provide both urgent care and behavioral health services to roughly 33 million Medicare beneficiaries nationwide. But there's a risk right now with some policies that are being considered that might limit the opportunity for Medicare beneficiaries with seniors and those with disabilities accessing it starting in January. So again, I encourage everyone to reach out to their lawmakers so that those in-person requirements are repealed.
Thanks, Latoya. Yeah, it sounds like that might be, no matter where you access healthcare, not losing the option to access care virtually might be a big accessibility issue, especially for rural folks or anyone who has transportation. And just as COVID's continually evolving, it seems really important to take action on that if that's something that might affect you or is important to you. But I know we will maybe have to move some questions to the end section, but some people are asking how to start your care plan with Doctor on Demand.
Sure. You have a few options. You can use your smartphone or your kind of smart device if you have an iPad or another tablet and download our app, Doctor On Demand. Or you can go to our website at drondemand.com and sign up there and begin your care journey.
Great. And then maybe we can drop that link in the chat as well in a minute. Finally, some folks asked what languages are available through Doctor On Demand.
We're really proud of our ability to provide culturally concordant and linguistically concordant care to beneficiaries and caregivers nationwide. So not only do we have interpretive services that are available to really help our providers and our patients really guide through that care journey, we also give patients the option to see our directory of healthcare providers so they can choose the provider that really does meet their own cultural sensitivities and needs. So there are I believe we have over 150 languages that are currently supported by our platform. And so we're really proud to be able to provide such a diverse and inclusive practice of healthcare providers to patients all across the country.
Great, thank you. You touched on this a little bit, but I think we have one last question, which is, do you anticipate virtual access changing as we potentially, hopefully, see the post-COVID phase?
I think the only changes that we will probably see are for the better. It was so nice to get such a positive response from patients and caregivers over the past year. And I know that really has informed the way that we provide care virtually. Our clinical providers, our programmers and engineers really do take that real-time feedback from our patients and make improvements on a weekly, if not monthly basis, so that there's a better and a more improved patient and user experience, hence our focus on that relationship-centric support. We realize that there are some things missing within healthcare and that healthcare is broken, and that if we can play a more pivotal role in really meeting the needs and improving the health experiences of patients throughout the country, then we really have done our job. Over the past few months, we've done a few things that we think will really improve virtual care for patients across the country. We have merged with two companies, Grand Rounds Health and Included Health. And we believe with those mergers that we can provide a more tailored experience and really meet the needs of patients, particularly those who are part of the LGBTQ plus community or allies of, and really using some of these virtual care services to navigate healthcare because there are a lot of threats right now. So we see continued improvements, but I do think engaging with your lawmakers to let them know what you'd like and what you'd like to keep is extremely important to ensure that public policy does not get in the way.
Great. Thank you so much, Latoya. And for everyone who's listening, if you have other questions, feel free to put them in the chat. If they come up for you later, feel free to put them in the chat. And then at the end, we'll have a Q&A with all of the speakers so we can go back to Latoya. But thank you so much for sharing that, really giving us a good overview of access points for people who want to use virtual care. And it's my pleasure next to introduce Lisa Schifferly. Lisa is the Senior Policy Advisor at the Consumer Financial Protection Bureau for Older Americans, where she leads the Managing Someone Else's Money program and support. We're especially excited about this presentation, given polling results from all of you, both today and other times, just mentioning how financial concerns, especially during the pandemic, and as caregivers, is a really top priority. So welcome, Lisa. We're really excited about your presentation.
Thanks, Lauren, and thanks to the Diverse Elders Coalition for having me here today. My name is Lisa Schifferly, and I'm a Senior Policy Analyst in the CFPB's Office for Older Americans. I'm going to let you know about some free resources for diverse caregivers and for diverse older adults who may be planning ahead for your own financial caregiving needs. And this is a really important topic because during the COVID-19 pandemic, more people have been called upon to act as caregivers, as many more adults opt to stay in their homes or move in with family members instead of moving to nursing homes or assisted living facilities. In fact, according to AARP and the National Alliance for Caregiving's Caregiving in the U.S. 2020 report, about 1 in 5 people in the U.S. act as an unpaid family caregiver right now. And many of these caregivers are women and diverse caregivers who may have to make their own financial sacrifices to act as caregivers. In fact, 61% of caregivers are female, and the growth in caring for an adult relative is up particularly markedly among African American caregivers and Hispanic caregivers. So, given the impact of COVID-19 on caregiving and the impact of the pandemic itself on diverse caregivers, we want to share with you some CFPB tools that we hope will help. So on the next slide, before I begin, I have to give this disclaimer, which is that anything I say is my own opinion and does not necessarily reflect the opinion of the CFPB. So let me start by telling you a little bit about the CFPB's Office for Older Americans. If you are not familiar with the CFPB, we are a U.S. government agency created about 10 years ago to help make sure that banks and lenders treat you fairly. And in the Office for Older Americans, where I work, we do research, policy, and education to help protect older consumers from financial harm. And we create tools and resources to help older people make sound financial decisions. So you can find all the resources I talk about today at consumerfinance.gov/olderamericans. They are all free and they are all available in English and in Spanish. On the next slide, I want to tell you about our brand new publication called Considering a Financial Caregiver, Know Your Options. We just released it earlier this year, and it's designed for people early in the caregiving process. Maybe you're just starting to notice that you or a loved one might need help with managing their finances, or maybe you're planning ahead for your own financial future. So what this is designed to do is let you know your options so you can choose what works best for you. So the publication covers informal caregiving options like convenience accounts or adding a trusted contact person to your account. It also covers formal caregiving options like power of attorney, guardian, trustee, and finally gives you a list of questions to help you consider who's the best person to choose as your financial caregiver. You can find this at consumerfinance.gov/MSEM, and I'll tell you a little bit more in depth about what it has. On the next slide, as I mentioned, it covers 3 different options for informal caregivers. If you just need a little help on an occasional basis with finances, these are some options that may work: conversation partner, trusted contact, and convenience account. So when we talk about a conversation partner, this is really just a fancy word for just giving a trusted relative, friend, or professional an overview of your finances. Next slide, please. You can share as much or as little as you want, and you're not giving up any control by having this conversation. For example, you might ask a broker or banker to send a copy of your statements to your daughter or to an accountant, or ask a trusted friend or relative to join you when you visit your banker or financial advisor. That way, if something happens, they'll know what this general status is of your finances. The next informal caregiving option that this guide discusses is a trusted contact person. And with the trusted contact person, what you can do is name someone, or actually up to 3 people, as trusted contacts on your brokerage account. And this allows a financial institution to contact the trusted person in certain circumstances, like if they think you're being scammed, like if I all of a sudden started wiring a bunch of money overseas to an online love interest, then my trusted contact would be notified that this is out of character and might be a scam. That's a very common type of scam affecting a lot of older adults. So trusted contacts don't have access to your money. They just get notified if the financial institution sees signs of exploitation. They are available on all brokerage accounts, and some other banks are also offering them as well. The next type of informal caregiving option that the guide discusses is what's called the convenience account. This is sort of the next step up. It names someone to help you deposit or withdraw money and write checks if you actually need help with paying your bills. And the big thing to know about this is it's not the same as a joint account where money is jointly owned and the joint account holder automatically gets the money when you die. Oftentimes people set up joint accounts when managing money just because that's what people are most familiar with. But this can have unintended consequences. To give you an example, if my mother were to set up a joint account with me because my brother is in Mexico and I'm here in the US living closer to her, then that might have unintended consequences. If she were to pass away, she would want her money to go to both of us, and the joint account, it would go right to me. Also, if I were to get in debt, then they could come after the joint account and come after her money for my debts. So that's why we recommend to people convenience accounts as opposed to joint accounts. Now, on the next slide, you'll see some of the formal caregiving options that the guide discusses as well. And I'll discuss each of these in a minute because we actually have complete guides on each of these types of formal caregivers that go in depth about what their duties are. But on the next slide, you'll see this choosing a financial caregiver guide. In addition to outlining informal and formal caregiving options, gives you a list of questions to think about when you're choosing a financial caregiver to make sure you choose someone who is going to manage your money carefully and responsibly, making sure they'll make decisions in your best interest, they'll manage it properly and carefully, they'll keep their money separate from your money and keep good records. It's also an important time to think about who can you talk to about these issues and who will honor your wishes. And also ask the hard questions about whether maybe the family member you're thinking of may have alcohol, drug, or mental health issues that might cause problems in the future in terms of their ability to manage your money. So on the next slide, you'll see our managing someone else's money guides. As I mentioned, we have one of these for each of the formal caregiving options. So that's power of attorney, guardian, trustee, and representative payee. And these guides help regular people who are acting in this capacity to understand what their duties are. They give you tips and resources to help you with protecting, investing, and managing the money. They also have information on identifying benefits that the care recipient might be eligible for, like disability, Social Security, Medicare, SNAP. And then they describe warning signs of financial exploitation and how to look out for scams. So let me show you a little bit about each of these guides. First, what's a power of attorney? A power of attorney is a legal document, and in it, someone who you call the principal gives someone else who you call the agent legal authority to make decisions about that person's money or property. This is really the main financial planning tool that a lot of people put in place so that if they become sick or injured and can't manage their finances, they can name someone in advance who they trust, rather than being in a situation where the court or someone else picks the person who manages your finances. So it's really important to think about why get a power of attorney. It gives you control to name who you want. It also makes it easier for your loved ones if you become unable to manage your finances. And you still have control of your finances until you're no longer able. One point I want to point out is a lot of people get healthcare power of attorneys, but forget about the financial power of attorney. You do need to make sure that you have both. If you want someone to be able to manage your finances, you need that financial power of attorney, not just the healthcare power of attorney. Now, on the next slide, you'll see our guide for representative payees and VA fiduciaries. These are people who manage someone's Social Security benefits or VA benefits, and they'll be appointed by that government agency, by the Social Security Administration or by the Veterans Administration. And they only have authority to manage government benefits. They do not have authority to manage any other money from that person. If you want authority to also manage that other money, then you need to get a power of attorney or guardianship. And then on the flip side, even if you are a power of attorney for someone, you do not necessarily have the ability to manage their government benefits. You have to be appointed by the government agency in order to have authority over those government benefits. So the next guide I want to tell you about is for guardians of property. These are also sometimes called conservators, depending on what state you're in. Some states call them guardians, some call them conservators. And this is when a court appoints someone to manage money that someone can't manage alone. For example, my grandmother unfortunately was hit by a car, went into a coma. She did not have a power of attorney. So we had to seek guardianship over her and go through a court proceeding and have a bunch of doctors to basically say that she was not able to manage her finances in order for us to manage finances. So it can be a very helpful procedure. It's also more lengthy and costly than power of attorney, which is why a lot of people do recommend getting that power of attorney in place. The next slide covers a trustee. A trustee is the type of trustee we talk about here is a legal document. And this is basically where someone gives authority to make decisions about money or property in the trust. So you could just put aside, say, $10,000 in the trust and give your son authority to that, or put aside your car in a trust and give your daughter authority over that. So it enables you to pick and choose what things you want to have other people manage by just putting some things in the trust. So those are all of our managing someone else's money guides. Again, those are available at consumerfinance.gov/MSEM. And on the next slide, I want to tell you about one other resource we have, which is called Planning for Diminished Capacity and Illness. This is a guide we put together with the Securities and Exchange Commission, and it gives you some other tips about planning ahead to help you stay in control of your finances in the future. And finally, on the next slide, you'll see our coronavirus page resource. And this is actually available not only in English and Spanish, but also in Chinese, Vietnamese, Korean, and Tagalog. I encourage people to check this out if they're in a financial situation, especially if they are worried about paying their rent or their mortgage and worried about the certain protections that expire at the end of this month. There are a lot of resources here to help you learn how to financially protect yourself, to how to get rental assistance or mortgage relief. And there's also more information for financial caregivers. It has short videos and read-alongs and a lot of other materials. So we hope you'll check that out as well. Next slide, please. And this has our contact information. We'll take questions on the webinar, but this also has contact information if you would like to contact me after the webinar. It also has our link to the Managing Someone Else's Money Guide. You can order these in bulk for free to pass out in your communities and share what you learned on this webinar with other people. So we hope you'll check them out. And if there's time, I'm happy to take questions now. If not, I will take them at the end.
Thank you so much, Lisa. That was really helpful. I was like taking my own personal notes around how I could use this information with my family, because it can be really confusing and opaque to try to navigate resources in those different formal relationships. We did have quite a few questions for you come in, but we are out of time right now, so we will move those to the end. But folks who entered those questions in the chat, don't worry, we will pose them to Lisa at the end. So please feel free to keep those questions coming in as I introduce the next speaker. But again, thank you so much, Lisa, for giving us that overview and then some deep dives into what those relationships can really look like.
Thank you.
So our next speaker that I am excited to introduce is Captain Susan Karol. Susan Karol is an MD. FACS is the Chief Medical Officer for the CMS Division of Tribal Affairs. As an enrolled member of the Tuscarora Indian Nation, Dr. Karol is a captain of the United States Public Health Service who serves to improve the health care of American Indians and Alaska Natives. And she'll be talking about the vaccine and COVID-19 prevention among diverse caregivers and their aging loved ones. So welcome, Captain Karol.
Hey, good afternoon, everyone, and thank you for inviting me to speak. I'm Dr. Susan Karol. I am with the Center for Medicare and Medicaid Services. And I think I just, in the chat portion, put a link to one of our proposed rules. And that will give you some information about some of the work that CMS is doing presently. And they're looking for commentary to that rule. So sometimes they're a little complex, but take your time, read through them. And if you can provide us with some requests or information that will help us with our rule making. As Lauren said, I'm a member of the Tuscarora Indian Nation. I've been working with NCOA, and I'm glad to be here today. And I heard that you needed to hear a little bit more about COVID-19 and probably the Delta variant that you've been hearing a lot about in the news. And I wanted to provide you with a few points today just to help remind you once again that this pandemic is not over. As you're hearing more and more reports, it's obvious that it is still hanging around. And so I'm here to once again remind you that if you have not got vaccinated, make sure that you do. Vaccination against COVID is so very important. I've had the opportunity in April and May to deploy with the Public Health Service as part of this administration's community vaccination plan, leading a center in New York along with FEMA, the U.S. Forestry Service, the Fire Service, AmeriCorps, and the U.S. Coast Guard. We were able to vaccinate over 58,000 people in that 2-month time period. So I know very much how important it is. I've learned a lot about the different vaccines. And there's probably about 20 other of these community vaccination centers across the country that have been doing very similar vaccination efforts. Just a little bit of information about the COVID vaccine. The information I could find in the last couple of days is that 161 million Americans have had their 2 shots, which is approximately 48% of the US population, give or take a point here and there. 85 million have received the Pfizer vaccine. 65 million received Moderna, and 13 million got the J&J. And I'm very happy to report that over 80% of the 65-year-old plus population have been vaccinated, which is great news, as they're the most susceptible subsection that has had the bad outcomes with the COVID infection. I like to speak a little bit about the Indian Health Service because that's where I'm formerly their chief medical officer, and where I have paid a lot of attention. They have provided 1.7 million doses of the COVID vaccine to American Indians across the country. As you know, they have one of the highest infection rates for US populations. It's over 3.5 times higher than the non-Hispanic white population, and American Indian and Alaska Natives are over 4 times more likely to be hospitalized because of COVID. So for that reason, I'm here today to give you a lot more information. IHS COVID tests have been over 2.4 million. And that's important too, because we want to know, who's being tested, who needs further help. And if you have need for further information about American Indian, Alaska Native data and what's going on, please go to ihs.gov, the indianhealthservice.gov, for more information. I have 10 important facts regarding the COVID-19 vaccination that I want to impart to you to keep you safe. Even if you've been vaccinated, you can still get COVID. I think everybody appreciates that. We're hearing a little bit about that. But vaccination is our most powerful tool to prevent the spread of COVID and to control the severity of the infection if you happen to get it. And just as a reminder, there are no virus particles in that vaccine. Some patients get nervous that they're getting a dose of the virus, and that's not the case at all. You cannot get COVID-19 from the vaccine itself. There are 2 COVID vaccines that require 2 doses, as you know, one given 21 days apart, which is the Pfizer shot, and the other is 28 days apart, which is Moderna. And then there's the one shot called the Johnson & Johnson or J&J vaccine. There's also a similar one-shot vaccine put together by AstraZeneca, which is available in Europe and may eventually make it to the United States. So you may hear about that one. And it's very similar to the J&J vaccine. The 2-dose vaccines, I just wanted to say, is the first dose really primes your immune system to rev it up to get it to take care of the spike protein of the COVID virion. The second dose is a booster, if you will, and provides better immunity up to the 95% effectiveness range. The 1-dose vaccines, the J&J, the effectiveness runs a little bit less, around 67%. But what it does do, it prevents you from having to be hospitalized and hopefully preventing any death related to the COVID infection. On May 10th, Pfizer received another emergency use authorization, or EUA, to provide the vaccine to 12 to 15-year-old patients. And for that age group, the vaccine is 100% effective in preventing COVID. And so that's really great news and great work from the Pfizer standpoint. There are clinical trials that are continuing for the other vaccinations that we are hearing a little bit more about. Moderna, I know, has been looking to provide their vaccine to the younger population. And there are additional, probably on the order of 9 or 10 other types of vaccines that are still in the making. So we may hear more about those as this pandemic continues. but just to keep that in mind. Some people feel sick after they get a dose of the vaccine. I know everyone, when I was providing the vaccine in New York, was concerned. And it's not that the vaccine is creating a COVID-19 infection, but it's causing an inflammatory reaction of your immune system. And by activating that, it's building up antibodies and T-cell immunity to the virus's spike protein. And in some cases, I've learned that if you've either had COVID or you've had the vaccination, sometimes you have this intense inflammatory reaction that is very much like a COVID infection. So that does happen. It is not life-threatening, and it is not. It does not create situations where you need prolonged hospitalization. The duration of protection against COVID after vaccination, or even having had the infection, may be as long as a year or longer. There is memory B cell immunity that creates these antibodies whenever you need it. So if you happen to be exposed again, there is the memory B cell antibodies that help prevent a significant infection. And you probably want to know about booster shots. That's still a hot topic. And presently that's still being assessed. And there is not a whole lot out about that at this point in time. I did want to tell you a little bit about the Delta variant that you're hearing all about. It's affecting over 80% of the new cases in the United States this week. It's highly infectious and very transmissible or contagious. And for that reason, we're going to talk about it a little bit more. The Delta cases are seen in areas of low vaccination rates. And that primarily this week has been in Arkansas, Florida, and Missouri, having the highest full-fledged outbreaks, along with Alabama, Georgia, Louisiana, Mississippi, Tennessee, and Texas close behind. This is the fourth wave of COVID, and this wave is affecting mostly 29 through 40-year-old patients. The vaccines do prevent against this variant, but you have to have both doses of the vaccine to receive the full effects and for it to be the most effective. So once again, a plug to make sure that you've had your vaccination, and please go get it if you haven't. An online report published on Wednesday this week in the New England Journal of Medicine discusses the Delta cases in the United Kingdom, and the effectiveness rates of the Pfizer and the AstraZeneca vaccine is at 88 and 67% respectively, which is very close to what the Pfizer and Moderna and J&J vaccinations have been for the Alpha variant of COVID. So that's good news for those of us that have had the vaccination. One of the things I read was the best time to get vaccinated for COVID, especially with the Delta variant, was about a month ago. So if you haven't gotten the vaccine, the second best time is to get the vaccination today. If you go to vaccine.gov, that's a very good website for finding out where the vaccination is available in a neighborhood close to you. The vaccinations function to build immunity so that if you're exposed to the virus, you can handle the virion and not require hospitalization. And probably most importantly, you won't die from the infection. You know, there are very rare reports, but the reason for vaccination is to help you fight off the infection. And you should also know that even if you've had COVID-19, you may still get the vaccination. And occasionally you might have a subvariant that might give you a cough or a cold. Sometimes people are saying, oh, I've got my summer cold. And it may be that the Delta variant is what they're actually dealing with, but it's not a significant infection. So again, vaccination is the most important thing you can do. Go to vaccine.gov, find a location near yourself and get your 2 series going. One last thing I wanted to talk about was the Surgeon General had a new advisory out this week, confronting health misinformation. The Surgeon General's advisory on building a healthy information environment He's working to activate trust messengers and groups and communities, and is a call to action for how we'll overcome this pandemic. So if you go to hhs.gov, you'll find his report, and just a plug for taking some time to read about that. We all need to help end this pandemic. Getting a vaccination continues to be a priority for you and your family. And as we have heard for the last year and a half, make sure you continue to wash your hands. Wash your hands. One more time, wash your hands, which helps to prevent COVID, but it also helps prevent the flu and any other infections. So make sure you continue with good hand hygiene. You want to continue social distancing. You want to avoid large compact gatherings. You want to disinfect touched surfaces frequently. And if you're a person at risk, consider wearing a mask. Those are my helpful hints for today. Nyawe to my Indian friends out there, and thank you. And I'll turn it back to you, Lauren.
Thank you so much, Captain Karol. I know that, you know, we all do want to move past the pandemic and are anxious for life to get back to normal, but it's very sobering and important to remember that we're not through with it yet, and that there's a lot of things we can do actively to take a role in protecting ourselves and our communities. I know a lot of folks on here are caregivers, and from the polling, keeping people safe is top of mind. So really grateful for those tips, and also just having information we can trust when there's so much information out there. You likewise received several questions, but I think we're going to have to wait until the end to get to those. But thank you again for that presentation, and found it really helpful.
Thank you.
Next up, I'm introducing Robert Espinoza. Robert is the Vice President of Policy at PHI, where he oversees its national advocacy and public education on the direct care workforce. He'll be talking about the importance of the home health care workforce and how to help advocate. Robert has a longtime connection with the Diverse Elders Coalition, so we're really excited to have him back here helping us out with this webinar. So welcome, Robert.
Thank you, Lauren, and thank you to the Diverse Elders Coalition for putting together this webinar. And thank you to all of my fellow panelists for their thoughts and their advice. I've been taking notes as well. Most of my presentation is really focused on the direct care workforce and the challenges that direct care workers are facing in society, in public policy, and what it would mean for all of us as older adults, as caregivers, or as people invested in this issue to advocate for these workers. I often get questions on what are the best practices for finding a home care worker, and that's less my expertise. So I've included in the chat a link from Family Caregiver Alliance with some really great tips and insights on how to find a home care worker. But I'll be focusing more on the policy dimensions and the advocacy opportunities. Next slide, please. Just as way of introduction, my name is, again, Robert Espinoza. I'm with PHI. We are a national organization that's focused on strengthening the direct care workforce. Specifically, we do research, we do policy analysis, we advocate for policy reforms at the federal, state, and local level, and we educate the public, for example, through workshops like this, about the challenges facing these workers and the need to improve these jobs. And our wisdom really comes from the work we've done over the years with policymakers, with payers, with providers or employers, and with workers themselves. We often say we have a 360-degree perspective on this sector and nearly 30 years of experience on both long-term care and this workforce. Next slide, please. Just to situate everyone, what do I mean by direct care workers? By definition, these are workers who support older adults and people with disabilities in a variety of settings. They work in people's private homes, in residential care settings like assisted living, and in nursing homes. And their titles do vary by occupation, they vary by state, and they vary by employer or by institutional provider. So you might hear them referred to as care partners by a local provider, or, depending on what occupation occupation, you're referring to home health aides, home care aides, nursing assistants, CNAs, etc. Our research shows that there are about 4.6 million home care workers and nursing assistants throughout the country. This is a workforce that is growing rapidly because of growing demand for these workers, largely spurred by the growing numbers of older adults in this country, and by just the fact that all of us are living longer, or I should say as a population, we're living longer. We do estimate that there will be 8.2 million job openings in direct care by 2028. What this means is that it includes about 1 million or so job openings that are being created by growing demand, but most of these job openings are actually being created by people who are leaving the labor force, and many are leaving this sector for other industries like retail or fast food, which tells us sort of the nature and the job quality challenges we're seeing in these workers. The direct care workforce is now larger than any other single occupation in the US. And they face a range of challenges, which I'll be discussing about, a lot of which is the fact that they are a critical yet untapped part of the interdisciplinary care team, where they can work with physicians and social workers and family members and others. Next slide, please. Who are just a few stats on these workers. Most of these workers are women, about 87%. 1 in 4 workers is an immigrant. 59% are people of color, and the median age is around 43, though our research also shows that 1 in 4 workers is aged 55 and older. So as our country has aged, so has these workers, and in many instances, we're talking about older adults taking care of older adults. Next slide, please. Unfortunately, these workers deal with a range of challenges, and I would say low compensation is chief among them. The median hourly wage for direct care workers is about $12.80 because many workers are relegated by the economy or their employer to part-time work. The median personal earnings for these workers is about $20,000 a year, and anyone who's ever done the math on how you spread across a $12 an hour wage across all the expenses that you have knows that this is impossible to survive on without public assistance in many ways. What we do show is that because of all of these factors, about 45% of direct care workers live in or near poverty. And low wages, by the way, doesn't just affect workers and their economic security. It also affects their ability to stay in these jobs, which then affects their employers, and it ultimately affects all of us who need these workers to survive on in our daily lives. Next page, please. This is a quote from Kulik's Wibinel in Stone Mountain, Georgia, who says, "Many CNAs do not get paid enough. You have a lot of responsibility taking care of members. But when you are not earning enough money to make ends meet, many people leave to find better pay." Next slide, please. Another challenge is limited training or career advancement. We know that training standards for many of these workers are simply insufficient and outdated, especially for personal care aides, which are the segment of this workforce that does not do the clinical support that home health aides or nursing assistants do. There is no federal training requirement for personal care aides, and there's no federal training requirement for direct support professionals, which are the segment of this workforce that supports people with intellectual and developmental disabilities. And that's a problem, right? We also have a lack of specialty training on a variety of topics like dementia care, for example, or in supporting special populations like LGBT older adults, or culturally and linguistically appropriate training that would support many communities of color. Oftentimes our experience in the field shows that the training methods and approaches that many employers or training sites are using, they're didactic in nature, and they don't often account for people, for adult learners and people with specific learning styles. They're classroom style, and they don't really, they're not the most effective approach for this population. And there are few opportunities for advancement where really workers could be better optimized in the care team, and where workers could see these jobs as an opportunity to advance and not necessarily leave this sector. Next slide, please. I just want to point out a few points related to this topic of diversity and equity, and that's really related to this idea of social determinants of health. It's a common term that can sometimes feel kind of difficult to understand. And I say the challenges that we see and the value that we see with these workers is that they are able to support older adults and diverse caregivers with a few areas, but they face some really key challenges in their lives and in their jobs. One of them is that many of these workers have faced discrimination across the lifespan in education and employment as two key examples, which then means that their earnings in later life and as their workers are also depleted. And this is a challenge that many diverse older adults face. Economic vulnerability is a big challenge. If you're making $12 an hour and only working part-time, you're going to see poverty and increased hardship. And this is something that diverse workers share with diverse older adults. Also, health disparities and challenges with accessing healthcare, and of course, cultural and linguistic barriers. As we talk about the barriers that older adults are facing with resources that are appropriate to their language, their culture, that's a challenge that we see also with training and with other supports that are geared at workers. They're often not culturally and linguistically appropriate for these workers. Next slide, please. We have seen longstanding challenges for these workers, and this is rooted in history. Many workers were exempted from wage and overtime protections all the way down to all the way as early as the 1930s, which of course has played out for years in how these workers are undervalued. Next slide, please. There are also disparities within this workforce. So women of color, for example, have lower wages and lower median family incomes than white men and white women in this sector. You can see the difference of $37,000 to $47,000. And those disparities are, of course, profound. Next slide, please. The COVID-19 crisis has amplified all of this. Many of these workers from the earliest stages had limited access to PPE and other supplies, also inadequate compensation, limited access to childcare. Hundreds of thousands of workers exited this field between March and May of last year. And while those jobs have restabilized by the end of last year, we're still seeing increased staffing shortages across this sector. And of course, not having a quality job can then impact your health, your finances, and ultimately your ability to support consumers. Next slide, please. Erica Honan says, I think isolation in general is a challenge for caregivers, but with the risk of COVID added, it has really been very taxing. I'd say that's the hardest part of the job for me. Next slide, please. So we often argue, what are the 5 pillars of direct care job quality? This is relevant not just for agencies that are hiring these workers, but for any consumer who hires a worker through a consumer-directed program. And we say there are quality training, fair compensation, quality supervision and support. Many workers often leave these jobs because of poor supervision, respect and recognition, and real opportunity. And on our website, I can include a link in the chat as well. There are 29 specific strategies that span these 5 pillars and can be used to really promote these jobs. Next slide, please. We also recently released a report that details our recommendations for public policy that we can all advocate on. Next slide, please. They cover 8 areas that address everything from addressing the financing that undergirds this sector, the compensation standards that meant challenges that many workers face, challenges with training standards and infrastructure, better data collection and more research. How do you really center these workers in policy and practice so they can be experts on their own lives? A wide range of gender and racial inequities that can be addressed in systemic ways through public policy, and shifting the public narrative, which is part of what we're doing, I think, on this in this webinar. Next slide, please. So in terms of the recommendations on racial and gender inequities, we would argue for strategies that are race explicit and gender explicit for workers, like training programs, for example, making sure that we're creating more workforce interventions that are geared at people of color and immigrants as 2 examples, and that they're being well evaluated and properly funded and replicated, right? And then of course, building supports for immigrant direct care workers, for example, like creating a pathway to citizenship for undocumented workers, but also supporting more interventions that support immigrants in this sector. Next slide, please. We also released a report recently, I'll include a link in the chat, around what the federal government can do. And this is where I think all of us can advocate for in terms of improvements. Next slide, please. So what are advocacy opportunities that each of us can take? Certainly we should speak to our elected officials at the local, state, and federal level and talk about, what are these challenges? We should look in our communities, who are those organizations or individuals that are addressing the issues involving direct care workers? In many cities and states, we've seen people form work groups or task forces of people who can organize and speak to their elected officials. It's always important to write op-eds or letters to the editor and to really focus on how it impacts you directly. What will it mean for you if you're not dealing with these issues already as you age, to not have an adequate workforce supporting you, right? And of course, the importance of including data and showing trends, which you can access on our website, and always reaching out to local, state, and federal officials. Next slide, please. I'll end with this quote from Marisol Rivera, who is a care coordinator in the Bronx. She says, "I think the role of the home health aide should be considered just as important as any other healthcare role." And we think that's really powerful because so often direct care workers are not given the same level of attention or recognition as other healthcare professionals. And it's important as we think about the future of the sector. The next and final slide. This is just a website for people who are interested in more information. Please visit us at phinational.org. Again, thank you, and I look forward to the questions and the conversations to follow.
Thank you so much, Robert, for that overview. And everybody, all the presenters, I'm so impressed, have been like down to the minute, perfect presentation timing. So I know that you're receiving questions as well, but those can get moved into the overall Q&A. But yeah, thank you for this overview and also helping. I love how much you brought together, not the narrative, but an understanding of how issues like racism affect people across the lifespan, from educational access to work choices and the care that they get, and really connecting the dots there. Also from some of our recent advocacy of the Diverse Elders Coalition around the infrastructure bill that's perpetually in the works. I can't echo Robert enough that people want to hear your stories, especially you all as caregivers. When we reach out to press or want to talk about the issues that are important to diverse elders, the question we just get asked a million times, who can we talk to in the community, who can share their perspective? So I encourage you, like Robert mentioned, write those op-eds, use Twitter, talk to reporters, get your story out there, because hearing your story is what will help policymakers learn how they can best support you. With that, I am going to transition to Ocean Lay, who organized this, our senior program coordinator at Diverse Elders Coalition, and he can walk the panelists through a Q&A before we close up. So Ocean, please take it away.
Thank you, Lauren. Just to echo Lauren's last statement, if you're ever, worried about sharing your story or have concerns, please visit the DEC as well, the Diverse Elders Coalition. We're here to uplift stories from diverse communities, and we want to make sure you feel comfortable and supported in doing so. And so, if you're interested in doing so, please visit the Diverse Elders, diverseelders.org. With that being said, I would like to start the Q&A session. There are several questions that came in, and I'll just kind of go through some of the questions directed at each panelist, and then from there, if other panelists want to offer some feedback as well, feel free to. This first question is for Latoya Thomas. Do care managers help with just the caregiver, or do they help with both the caregiver and the person who they are providing care for?
That's a great question. They help with both. Certainly it depends on the needs of the caregiver and the needs of the family member that the caregiver is caring for. But our care managers, albeit virtually, are skilled in really supporting the needs of anyone across the life cycle. So you can be as young as 1 year old, but you can certainly be over the age of 65 and receive our virtual care services. We specialize in primary care, urgent care, and behavioral health. But because of some of our more recent partnerships, we've been able to expand our care management experiences and extend expert medical opinion so that you can receive a second opinion from a specialist. Perhaps you've received a diagnosis about something, and before proceeding with the intended treatment plan that or treatment options that you might be considering, perhaps you want a second opinion, and we're able to through our partnerships offer you that virtual experience too. So very vast, very broad, and really proud of it.
Awesome. Thank you for that, Latoya. Okay, our next question is for Lisa. During your conversation, Lisa, someone asked, should I open a convenience account with my dad, who is my care recipient? And so if he has debt, will it affect my credit score?
That's a really great question. Basically, convenience accounts are bank accounts rather than credit accounts, so they should not affect your credit score. But just to be clear, for the convenience account, it would be the parent that's opening it and then putting you on it as a convenience partner so that you could write checks, on their money just to help them with paying bills and things. So it really would affect their credit more than your credit, but it shouldn't affect credit because it's a bank account rather than a credit account. But if you are concerned, I would suggest asking the bank those questions and also asking them whether they're going to make a hard inquiry or soft inquiry into your credit before putting you on the convenience account, because that can affect whether it's going to affect your credit as well. And also asking the bank whether the banking account is attached to any credit account, because sometimes they're bundled together. So you want to make sure that the credit isn't accidentally affected by that. So I would definitely ask questions of the bank before setting it up if you're in the situation that you described.
Thank you for that, Lisa. And for those who don't know the difference between a hard and soft inquiry, I'm sure that's just a credit check. Is that correct?
Right. It's different kinds of credit checks, and what they call the hard inquiry will affect your credit more than the soft inquiry.
Awesome. Thank you. And then a second question for you, Lisa. Someone mentioned during the power of attorney, where do I get these documents to become a power of attorney?
Well, I would suggest consulting with an elder law attorney. And I put in the chat 2 different ways you can do that. One is to contact your state or local bar association, and the other is to contact the National Academy of Elder Law Attorneys, which is at naela.org, and the link's in the chat. A lot of people are tempted to get these online power of attorney forms, thinking that it'll save money, but it may be penny wise, pound foolish, as they say, and lead to further problems down the road. So I would suggest getting an elder law attorney to make sure that the power of attorney document is done properly and doesn't cause you or your loved ones, further problems down the road.
Awesome. Thank you. Okay, moving on. This next question is for Captain Susan. Do current vaccines protect effectively against the Delta variant? And if so, should I continue to wear a mask outside even though I have gotten the vaccine?
So 2 questions. The first one is, should you get the vaccine? Yes. The present vaccines, the Pfizer, Moderna, and Johnson & Johnson, do cover the Delta variant. So if you've had those vaccines, you're in good shape. The effectiveness for the Pfizer and Moderna is roughly around 88%. So there's a 12% gap where you could still potentially get the Delta virus, but hopefully not as significantly as if you didn't have the vaccination. And with the Johnson & Johnson vaccine, it's at 65%. So same story, there's still a good 40% where you might get the Delta variant. So you still need to be careful. You still need to wash your hands. If you are a person that has risk, you're greater than 65, if you have chronic medical conditions, if you have a condition where your immunity is impacted, then yes, you want to potentially wear a mask when you're out and about to protect yourself. from the Delta variant and potential future variants. The virus will continue to mutate. There will be other variants that will come along, much like the flu. They think that it may be that on an annual basis, they will need to reformulate the vaccine to affect the present variant that may be circulating in the communities. So our best chance is really for everybody to get vaccinated as much as we can to help inhibit the virus from continuing to replicate and mutate.
Thank you for that answer, Captain Susan. That was very helpful. We have another question for you here from the audience, and it reads, what happens if I test positive for COVID in between vaccine shots? So I'm assuming this person is talking about Pfizer and Moderna. Do I have to get both doses again?
So the answer is no. You've had one dose, you've been ill with your COVID infection. We'd like you to get over that infection so that you're comfortable, you're out and about and not infecting others, and then get your subsequent dose. The EUAs that go with each of the 2-dose vaccinations provide the second dose may be given as long as 6 weeks after the first dose. But having been in a situation where we've had individuals that have come in after 6 weeks, we still just give the second dose that completes your series, and then we'll see how the information, all the data plays out with the pharmaceutical companies and the CDC before they determine exactly when and if a booster is needed and when and if you need additional dosing. So for now, get your vaccine. If you get COVID, get better from that, and then get your second shot.
Thank you. Thank you for clarifying, Captain Susan. I know a lot of people are wondering what happens if they test positive between shots. So thank you for providing that information.
Sure.
This next question is for Robert. And it seems, sorry, I just started reading the question. The question reads, it seems that many direct care workers do not get paid enough, and yet sometimes it seems that getting respite or help from home healthcare workers is expensive. Where does this money go, and how can we help support?
Yeah, it's a great question. I mean, there's 2 points here that I think are worth referencing and speaking to. One is just how expensive home care can be for people, even though it will feel more affordable than, say, a nursing home and a long-term care, a residential care setting. People will pay about $21 on average per hour for a home care worker, which I think the average annual cost is around $2,000 to $3,000 a year. So it does feel expensive. And it speaks to just how do we create a system in general where long-term care is more affordable to people. In terms of where does the money go if you pay that $21 to an agency, it typically covers administrative and operating costs for the agency. And it includes personnel costs, which is where the wages and benefits, if they offer, are also covered. But it has raised a lot of questions, I think, for people in the field. If I'm paying $30 an hour and the worker is making $12 an hour, does the agency really need the remaining amount, right? And certainly agencies would say yes. There's quite a bit of work that goes into operating a home care agency and quite a bit of paperwork often that needs to be administered that in itself raises those costs. But I think the general piece here is from an advocacy standpoint is that we need to find ways that both raise the floor on wages for workers, probably not just to $15, but probably closer to $20 so that, these wages are not just appealing to workers, but they're competitive in a sector where these workers might go to retail or fast food for the same job, right? But the other piece is that in a system that's so reliant, I think, on Medicaid funding, we need to find ways to bolster the financing for Medicaid so that providers get more in reimbursement rates to be able to cover those costs. And we need some deep analysis on the extent to which some of these administrative operating costs might be too much, but I wouldn't start with that assumption necessarily. Yep.
Okay, awesome. Thank you. And I believe we have enough time for one more question, and it's a great follow-up to your explanation that you just provided. And so it reads, how do we help advocate for better supports for direct care workers? Should it be geared towards federal and state officials or to institutions providing home health care workers?
Yeah, I mean, certainly both are important. If you're interested, if we're interested in changing the systemic challenges that are facing these workers, from compensation to training to advancement to financing, as I just mentioned, then it's a question of public policy. And in that sense, it's better to connect with your elected officials, your local, state, and federal, depending on the issue. But however, employers, there are ways to advocate for employers to change their practices and provide better services and supports. And so in that instance, that works as well. But there are definitely two trains running, and I think both are beneficial. I also want to address the question around immigrant direct care workers, which was brought up in the chat. In many instances, the supports for immigrants is around federal because of just federal policy and immigration. And there, the measures really are about providing a pathway to citizenship for undocumented workers. And a great bill that was introduced early this year on the U.S. Citizenship Act of 2021 that would provide a pathway to citizenship for undocumented immigrants, many of whom are direct care workers. So there are ways to advocate for that, and I'll include a link. But there's also a way to advocate at the state and local level for more money that support programs accessed by immigrants, whether it's immigration supports, wraparound services like childcare, paid sick days, transportation supports, et cetera, because those are all critical for low-wage workers, including immigrants. And I think the more we bolster that system, the better they'll do on the job. Yeah.
Awesome. Thank you. Thank you, Robert. And so, yeah, that wraps us up for the Q&A session. There are some questions outstanding. And again, as a side note, I want to mention that, this recording will be recorded, and these questions that are outstanding will be answered in that email to participants and registrants. And so if your question wasn't answered, don't worry about that. We'll make sure to get to it. With that being said, that concludes the Q&A session, and I would like to pass it back to my colleague, Lauren Pongan, who will launch the third polling question.
Thanks so much, Ocean. And thanks to all the speakers for getting to those last bits of information that weren't captured in your presentations, but are at the top of people's minds. For those of you who are caregivers in the audience, we have one last question that I'll ask Nina to launch now, just so we can hear back from you one last time. So what's one new thing you learned today? Options are telehealth, accessing resources in rural and urban settings, LGBT-friendly resources for caregivers, the COVID-19 vaccine and keeping safe, financial resources, home health care resources, and how to help advocate, or other. So I'll just give this a couple more seconds. Looks so far like a lot of people learned about financial resources and telehealth and how to help advocate. Okay, looks like we're basically at 70% participation. So it looks like the thing that was most illuminating for people was financial resources and telehealth. I know that in particular, for me, finances often seem really opaque and hard to access. So it's really great to be able to hear from experts on how different ways to proceed and learn new resources. So thanks for everyone who responded to that polling. Just to wrap up, I would again like to thank you for attending this webinar, participating in the polls. We'll be using the polling information just to help inform what future webinars look like and what other resources people have expressed that they need. Again, another thank you to all of our panelists for being with us on this Friday afternoon, to the Johnny Hartford Foundation for their generous funding support to make this webinar possible, to Ocean and Nina, our Diverse Elders Coalition staff, for organizing this great event. And with that being said, we'd love to wrap up. I know if you're a caregiver, we've offered short incentives for your sharing your opinion. So look out for an email from training@diverseelders.org as follow-up to that. And again, if you want more resources, they're here in this slide deck, or you can visit us at diverseelders.org. So have a wonderful day, everyone, and have a great weekend. Thank you.
Thank you, everyone.